Hello, ladies and gentlemen of good fortune. Thank you for listening to me today. I come to you in fulfillment of my promise. My name is MC Chipano. I come to you in fulfillment of my promise to talk to you about something that some of our family members go through, and that thing is what is called stroke. So about 7 months ago, my grandmom, who is 90 plus years old, she was still going vibrant. We noticed she started having some weakness. She became confused. Her speech was affected. And so we rushed her to the hospital. When we got to the hospital, she was diagnosed with a stroke. But everything that was not supposed to be happening was actually happening. Everything that they were not supposed to be doing to a stroke patient is what they were doing to her. Well, unfortunately, it is in a place where some of our family members are back home, where medical attention, medical care is not really at top notch. However, some of us have the privilege to know a little bit that we can actually share with the everyday you and I. So we recently just had what was the Stroke Awareness Week, and so it dawned on me that I should actually take time off and just share a little bit of knowledge with you guys on what I know. Maybe it could help you or help somebody. So I'm going to talk to you about stroke. I'm going to start with the definition of stroke. I'm going to tell you what the symptoms are. I'm going to tell you the causes. I'm going to tell you how to treat it, but I'm also going to tell you most essentially what to and what not to do when you get to the hospital. So stroke, simply put, is damage to the brain as a result of insufficient supply of blood. This can be caused either by bleeding that reduces the amount of blood that's going to your brain, or by a blockage in your vessels. It represents itself in what we call like a transient ischemic attack. That big term, just TIA, simply means that it's something that is temporal. The stroke is temporal, and before you know it is gone. So 1 minute you have weakness in your arms, the next minute it is gone, and then you don't have any symptoms. At other times, it could just be an ischemic stroke, which is actually a blockage in the vessels, or it could be a hemorrhagic stroke, which is bleeding. Be that as it may, when you think of stroke, this is how we put it. When you think of stroke, fast. And what does that mean? Facial droop. Anytime you see somebody having facial droop, like the face is like kind of falling down, face is just like flat, any of that, facial droop, arm weakness, speech slur. Time means that you should rush to the hospital, get the person immediate medical attention, because they're going to need it. There are other symptoms. Sometimes they could have like their eyes, they're not able to see very well, blurry vision, headache, confusion, and all that stuff. If you have any of these symptoms for stroke, you have to rush and get yourself immediate medical attention. What are some of the risk factors for stroke? One of the risk factors will be high blood pressure. High blood pressure the pressure on the blood vessels over a long period of time will damage the vessels, and it could lead to a clot that could eventually cause a stroke. At other times, it could be high cholesterol. An increase in the cholesterol, in your cholesterol levels, could build up what we call plaque. That plaque builds up sometimes in the vessels, and then it blocks the vessels, and then you do not have enough blood going to the brain. At other times, it could be trauma that causes bleeding, also could result in a stroke. There are just some other few things. Some people have like diabetes, alcohol consumption, simple things like that. Smoking can also cause you to have a stroke. But more importantly, some people, especially some of the black folks, who have like high blood pressure, who are likely to have high blood pressure, they should pay attention to what like their family history. So some of our family members who have suffered from stroke could also be at risk for also suffering from a stroke. But also some persons who have had stroke in the past are likely to have a recurrence in the stroke. What do you do when you have a stroke? When you have a stroke, first thing that we are suggesting to people, No, before you have a stroke. This is how we suggest to people who are at risk. Take care of your risk factors. Get on medication. Make sure you take like your blood pressure. Those who are likely to have high blood pressure, check your blood pressure. And if it is getting too high, take medication. Talk to your doctor about medications to treat your high blood pressure, treat your cholesterol, treat your diabetes. If you are smoking, needless for me to say quit. Okay, if you are a drinker, high alcohol consumer, we plead with you to quit. If you cannot quit, at least reduce your consumption of alcohol. That will help you go a long way. All right, now on to something that I consider to be the crux of what I want to focus on, especially for those of you who are back home, who have loved ones, or who are in a place where medical attention is not at its best. In the bare minimum, if you or your family member finds themselves attacked by a stroke, when they get to the hospital, pay attention. 3 main things. The first thing we do is to put the person on fluids, continuous fluid. What that means is just increasing your blood volume. Sometimes we normally use like normal saline, but whatever the doctor prescribes, you have to put the person on fluid so that it would increase their blood volume and get the blood going back to their brain to help their brain recover from the damage that it has suffered from the insufficient supply of blood. So continuous fluid is the first thing that they have to pay attention to. Secondly, do not take any blood pressure medicine while you are having a stroke. So before, if you have high blood pressure, we suggest take medication to reduce your blood pressure. But after you suffer from a stroke, or in the immediate aftermath of suffering from a stroke and you are at the hospital, do not continue taking your blood pressure medication, because this will act contrary to the intended solution. The solution will be to provide you, to help you get more blood going to your brain. So you cannot be taking, and you should not be taking, any blood pressure medicines when you have suffered from a stroke until the doctors deem that it is now conducive, or it is now safe for you to get back on those medications. But while you are in the hospital, or immediately after you suffer a stroke, do not agree that the doctor should continue giving your loved one any blood pressure medicine, because that will reduce their blood pressure and that will not help their recovery process. I cannot emphasize enough, continuous fluid, blood pressure medication should not be given to them while they are at the hospital. And if you do that, trust me, a little bit of time could help your family or loved one go an extra mile, help them recover from it. Ladies and gentlemen, stroke is not the best, but if you take time, follow up with your loved ones, and whenever they get back, they cannot relapse on their medicines. What we notice is that people come into the hospital for stroke, we help them get better, they go home, they relapse on their medication, and then they come back. When you go home and the doctor says, okay, now start taking these medicines, do not relapse on your medication. If you do, you have a high chance or probability to find yourself back in the hospital. Ladies and gentlemen, I'm going to leave it at this. Thank you very much for listening. I try to make this as brief as I could possibly do it. This lecture is not for people who are nurses or doctors to use and validate their course on stroke. This is just for the everyday you and I to get a little bit of knowledge, just to be aware of what is happening to the people we love around us. Thank you very much. As always, MC Chipano. Stay blessed and have a blessed day.